let me say that this country has changed a lot in the last 30 or 35 years, in the sense that we used to be a country that was from the middle to below the middle in most of the socioeconomic indicators in Latin America. But we, early on, since the middle 80s, we opened to world trade. It's a very open country today, so that allow us to benefit from specializing and to trade with the rest of the world. This is a very small market, so there was no point in producing cars in Chile. Today we get all the models of cars through international trade. So we export copper, we export wine, we export salmon, and we buy things that we cannot produce. Now we have a very strong middle class that we have created because of the success. So Chile has around 60% of the Chileans belong to the middle class, 60 or 65, depending on the measure that you use it. So that middle class today is very independent, is demanding better public services, and one of the public services that is demanding better public service also from the point of view of health. When people were below the poverty line, most of their concern was to get food on the table. Today they have other needs, and one of the needs is better education, better health services. They want a better environment, so there's much more awareness of the environment. Until before, it was just the awareness was to get food on the table. In health we have two parallel systems in health. We have an state system where around 80% of the people use the state health system, but the state health system is very badly run. They have a problem of management, and you don't get enough doctors because they don't pay well, the state. At the same time, given that they don't pay well, they don't have enough beds in the public hospital to keep the people, so people had to have long queue to get a space in that. And in parallel, you have like an insurance system where people can buy insurance, but the insurance can be bought only around 20% of the top 20% of the population is buying private insurance, and the other 80% is going to the middle class, and the low middle class are going to the state system. So there we have a problem of incentive. We have a problem of the management of the hospitals, in the sense that you need to put professional managers, but most of these are dominated by the political parties. So we have a problem on the use of resources. So, but all of that are problems that came out when you have been already successful in creating a very strong middle class, because the middle class is now demanding better health services. They don't want to queue. When they were in the poverty, the only thing that they wanted to get the bed. If the bed is going to be given in the hospital a month from now, so be it. Today, they want the bed tomorrow. To have a public policy on health, it would help a lot from the point of view of knowing what is the most effective way to manage resources in the health system. So maybe we're going to learn that the biggest payoff it comes from prevention more than curation. So on prevention, what are the best way to spend your money on prevention? What we have learned internationally on prevention? What we have learned internationally from the point of view of incentive to run better public hospitals? What do we know worldwide? What have we learned on that area? And in the same from the point of view of medicine, I'm saying if you are going to spend money on medicine, what is the best way to do it? In the sense, the contribution of generic drug in the last 15 or 20 years that has reduced substantially the cost of access to medicine and so on. So in all these things, I have learned that there's a lot to learn from the international experience.